Hi, I'm Catherine Ayers-Wickenhauser, Director of Communications at Direct Trust. And today I'm so excited to be joined by Dr. Chip Grant from Watershed Health, who has recently been named one of our interoperability heroes. So Chip, welcome. Will you introduce yourself and tell us more about Watershed Health?
Sure. Thanks, Catherine. I'm glad to be here with you. So I am Chip Grant, founder and CEO of Watershed. I am a cardiologist, so I'm a clinician. And I guess going right into your question about Watershed, Watershed comes from the fact that I am a clinician, and as a practicing clinician, I saw a huge recurrent problem in my own patients that, as it turns out, was all about interoperability. And so Watershed is an effort to solve that problem and to, in doing so, improve patient outcomes.
Awesome. And I love how you are drawing from your personal experience and your professional experience as a clinician. And you mentioned the issue of interoperability. And often interoperability comes back to data and moving the appropriate health data from one place to another and getting it into the hands of people who need it. So can you maybe tell me a little bit more about how Watershed Health is connecting organizations and even maybe how that interoperability has empowered them?
Yeah, no, that's great. So you're the interoperability pro. Thanks for the hero status. But the truth is that interoperability is certainly nothing that we invented. But I think my definition of interoperability is a little bit maybe slightly different than what folks are used to hearing. To me, interoperability has two parts. One part is connectivity, right? So connectivity has to exist. And one of the things that we believe with Watershed is that, no part of the healthcare network can get left out. So connectivity has to be, every provider that's touching a patient connected. So that's, the traditional hospital doctor, specialist primary care, the non-hospital organizations, hospice agencies, home health, skilled nursing, but dialysis centers and wound care. It's got to be, durable medical equipment companies, and on and on and on. But it also has to be these so-called non-clinical healthcare providers, folks that support patients that are socially isolated, folks that provide meals, housing assistance. And so connectivity has to be complete. And frankly, I think that's one of the places where we've fallen short in this country. But the much bigger part of interoperability, in my opinion, is the second part, which is providers engaging around certain behaviors that drive interoperability. Interoperability sort of as a state is a nice idea, but interoperability really means providers engaging and doing things with one another around, care coordination. So communication is one of these key things. Data sharing, which again, when we think about interoperability, we think of health information exchanges, but real data sharing of key information, the just-in-time information that's needed to take care of a patient. Following care pathways or best practices, usually based on guidelines, is another key behavior and when interoperability exists. And also quality assurance, process improvement is another thing. So for us, our belief is that in order for real interoperability to exist, you have to have the connectivity, but you also have to have providers engaging and doing these behaviors. And the problem has been, in my opinion, that historically we've had some of the first, and the second part has been inconsistent. So what we've done with Watershed is to address both parts of this issue. One part being total connectivity in communities to include all of the different disparate providers that I described. And then the second being to figure out a way to measure key behaviors as they're happening and not happening, and then promoting providers that are engaging so that it's clear to the greater network who's sort of really doing the work of interoperability. So for us, Watershed becomes a facilitator of the work of interoperability, but even more a promoter of interoperability. So as we go from community to community, and we see outcomes improving across the spectrum of post-acute care, like hospital readmissions or ER visits, but then into chronic disease management, where patients are having their diseases better controlled. What the common denominator really is this connectivity and these behaviors. And we've been fortunate to be able to provide a platform where those things can occur.
And I want to take some of this and take it apart again. And I want to tell you what I just heard. Because for interoperability, which has been around for a while, Direct Trust is getting ready to celebrate our 10th anniversary. And so from the people who have been involved in interoperability, I think you hit the nail on the head that for so long, it's just been focused on building the infrastructure, right? Technically, can this happen? But the second piece and what you're referring to as provider engagement and what we sometimes refer to as use and usability and actually taking that information and making it actionable and then doing something with it to get to that state where we are improving healthcare. It's really interesting to hear how those pieces came together for you and how you are really bringing together the entire community, because you're right, if people are left out of that circle or there's just a few people who have access to that interoperability, it really doesn't do any good. You need to have that whole community involved who's taking care of a patient. So maybe can you tell me a little bit more? Are there specific examples of that stick out to you of where those pieces have all come together? So you mentioned the post-acute care space.
Yeah, and I also want to, I think that the part you mentioned about the fact that, first of all, that this has been a tremendous undertaking. First we had meaningful use, which is now actually called, interoperability, where gajillions of dollars were spent on electronic health records and then health information exchange. And by the way, none of where we are now would be possible had it not been for those things. Practitioners, providers all across the spectrum have had to engage and work towards transitioning to these technologies. So that's been remarkable. That said, there have been lots and lots of providers that were kind of left out of that. If you think about meaningful use and interoperability, it was mostly about hospitals and doctors. And most of the funds were pointed in that direction. Again, it turns out that when you're doing healthcare, in the United States, you're managing patients with chronic conditions. It's a team sport. And if you leave anybody out, the whole team is going to fail, because fragmentation at any point along the way, lack of interoperability is a killer. So one of the things that we've had to really embrace from the get-go is the idea that you've got, with a technology like Watershed, you've got to meet providers where they're at.
Mhm.
Not sure about the English there, but you get my point. If we're working with a hospital that's using Cerner or Allscripts or Epic, and they've got a sophisticated interface, be it Fire or HL7, we've got to be able to connect and create the connectivity so that we can then do the interoperability. But if we have a provider organization out in the community that doesn't have the ability to interface, but that is using direct, we have to be able to do that too. And we're delighted to be able to do that too. As a matter of fact, that's one of our favorite ways to connect, because it's such a good news story. It's about a 5-second lift on their part, which is great. But again, remember that interoperability has two pieces. It's the connectivity is the first piece. So without that, you don't have interoperability. And so, even on further down the line, when we're dealing with a homeless shelter that's helping take care of patients that are coming out of a hospital, we have to be able to create connectivity with them. And so that's really been our obsession, and we've been delighted with the work that's gone on with Direct, because it's helped us tremendously.
Awesome. Well, thank you, Chip, for that. And it's always interesting too, because you hear about these different approaches to interoperability, the different technical standards that are out there with interoperability. And you touched on something. You said interoperability is a team sport, and I could not agree more. And I think even expanding that and just looking at the broader community, I like to refer to it as Team Interop. I think everybody's kind of on the same team, even though we all have our different technical standards that we like to support and cheer for. We all obviously are focused on something and have this goal. And that goal, I think, is really around the quadruple aim. And I see threads from our conversation today of how this all comes together. And maybe before talking about the quadruple aim, I just want to mention I am very appreciative of talking about the entire circle of care and anyone who might help provide care for a patient, because I think, again, so often, like you mentioned, with meaningful use and others, we were focused on certain areas of healthcare, and that was kind of the mainstream thing. But now it feels like there's been this tremendous shift in the industry finally to focus on more areas and expanding and creating interoperability access in many different places so that we can truly get to the place where we are taking care of a whole person, or providing access to care for a whole person. So I really appreciate that. And I think that does tie to the quadruple aim of decreasing healthcare cost and increasing quality and engaging patients and improving population health and decreasing provider burnout. So I'm just curious, as a clinician, what are your thoughts there about how these pieces all come together for you?
Yeah, I mean, that's the why. And I love what you said, because the what varies. And direct is one of the whats. It's how we're getting there. So are the fire standards. So so are these other things. And I guess to some extent, Watershed's a what. But the why is the thing that gets us up in the morning. And it's frankly how I'm able to not stand in the cath lab putting stents in people and still feel really good about the work that we're doing, because fundamentally it's the same thing, right? It's exactly as you say. It's better patient outcomes. And the good news for those of us that need to pay employees is, it turns out, when you improve patient outcomes, you save a lot of money, and hopefully we can find people that can support what we're doing off of those savings. But of course, when patients are having less hospitalizations and other adverse outcomes, they're satisfied, right? And then meanwhile, I do think that healthcare providers are doing what we do because we ultimately believe in the mission. And we're not bankers and lawyers. Some of us would probably be decent bankers and lawyers, but we really are about patients feeling better and living longer. So I couldn't agree more I think that the why of the quadruple aim is the reason we're all here, and hopefully we will continue to be a valuable resource to those efforts.
Awesome. Well, thank you. And before we conclude today's conversation, I'm curious, any final thoughts or maybe words of wisdom that you've encountered or generated on this journey of yours too?
I think that the big thing is, after now doing this with Watershed for nearly a decade, is that I'd love to believe that there are easy paths here, but we are dealing with a complicated, really sort of industry that started as a kind of a cottage industry with all these little disparate providers all over the place, and each of them developed their own way of doing things and their own systems over a long time. And now what we're trying to do is connect all these things, and it's hard work, and it's going to be hard work, but the mission is a good one, and it's definitely worth the work. So I think we all just have to keep our heads down and keep going.
Well, I think that's great advice, and congratulations again on being recognized as an interoperability hero. And to watch more Interop Hero spotlights like this, visit directtrust.org/Interop Hero.